If your blood sugar is harder to control than it should be, even if you're eating well and exercising, there might be something else contributing, something most people never think to check, and that's your gums. I'm a dentist, and from what we know is that inflammation in the mouth doesn't just stay in the mouth. In this video, we'll break down how gum disease can silently raise your blood sugar, make insulin resistance worse, and most importantly, what you can do about it. So make sure you stick to the end for that. But here's the tricky part. Most people with gum inflammation don't know that they have it. And it doesn't always hurt, it doesn't always bleed, and by the time you do notice a problem, it's usually been going on for months or possibly even years. And while it's quiet at the surface, it's not always silent beneath. So gum inflammation is a form of a chronic low-grade infection. And just like any other infection, your immune system responds. And what it does is it sends white blood cells, immune messengers, inflammatory chemicals to fight off the bacteria along the gum line. And what this does is it creates a constant low-level immune battle in your mouth. And the more inflamed your gums are, the more your body has to fight. Now here's where it gets interesting. The cells in your gums release something called pro-inflammatory cytokines, which are basically little chemical messengers that don't just stay in your mouth. They travel through your bloodstream and they can affect how your body basically uses insulin. But this creates a problem. If the cells in your body are already struggling with insulin resistance, adding constant inflammatory signals from your mouth makes things worse. It raises background inflammation, and higher inflammation makes your body less responsive to insulin. And this is how gum disease quietly worsens blood sugar control, even in people who think they're brushing well. Now let's look at what this actually looks like in your day-to-day life, because gum disease doesn't always scream, sometimes it whispers. And this is exactly why it gets missed, even by people who think they're doing everything right. And this brings me on to the first sign, which is your gums bleeding when you do normal brushing or flossing. And it may not happen every time, but it can happen maybe sort of if you're flossing, for example, around your back teeth, and you might spit and notice a faint streak of pink. But here's the thing. Healthy gums should not bleed. Bleeding means inflammation. Inflammation means your immune system is in overdrive. And if your immune system is constantly on, or if it keeps firing those low-grade inflammatory signals, it adds fuel to the fire of insulin resistance. And bleeding gums may not seem like a big deal, but in the context of blood sugar, they're a red flag. And the second sign is your breath smells bad no matter how much you brush. Now, I'm not talking about the smell after having garlic or coffee. I mean sort of the stubborn, sour, metallic smell that clings in your mouth even after using a mouthwash. The kind of breath that comes from volatile sulfur compounds, the byproducts of bacteria along the gum line. And those kind of bacteria are thriving in pockets of inflammation, and they're not just making your breath worse, they're keeping your immune system activated. And think of it like a visible infection that your body has to manage every single day. You may not feel it, but your body does. And sign number 3 is you feel more tired after meals or a crash an hour later. And this one surprises a lot of people because they don't connect oral health to energy. But here's what might be happening. So if your gums are inflamed and your immune system is constantly firing, your cells become less responsive to insulin. And this means that sugar doesn't enter your cells as efficiently. So it floats around in the bloodstream longer and your energy then becomes unstable. So that post-meal fatigue, for example, is not always the food. Sometimes it could be related to inflammation. So if you're brushing every day, eating mostly healthy, but you're still crashing after lunch, your gums can sometimes be playing a bigger role than you may think. But those are just surface level signs. There's one deeper layer most people and even some doctors completely overlook. It has to do with how your mouth affects your blood vessels. And that's what we'll get into next. It may be the most important connection of all. But before we do, if you're getting any value out of this video, make sure to hit the like button. Apparently it helps this video reach more people. So how exactly does gum infection in your mouth end up affecting blood sugar? It's not just the inflammation in one area, it's what the inflammation does to your entire system. And it all starts with the blood vessels. So every single blood vessel in our body is lined with something called the endothelium, which is a thin, delicate layer that controls how substances pass in and out of our bloodstream. And think of it like a gatekeeper. So it manages things like oxygen, nutrients, and yes, insulin. But when inflammation in your mouth starts leaking into your bloodstream, it doesn't just stay local. It causes something called endothelial dysfunction, which is just basically a fancy way of saying that the gate doesn't open and close properly anymore, and that the insulin doesn't work as efficiently, and that the blood sugar stays elevated. But here's the kicker. So this dysfunction has been directly observed in people with gum disease, even mild gum disease. And we're not talking about people with obvious pain, loose teeth, or full-blown infections. We're talking about normal-looking mouths where the inflammation is happening silently just below the surface. And it doesn't just stop at insulin. Endothelial dysfunction increases your risk of heart disease, high blood pressure, and even stroke, which are already more common in people with type 2 diabetes. And it's not just gum disease and insulin resistance that show up together. One might actually be driving the other. So we've covered the hidden link, and we've seen how gum disease fuels inflammation and how inflammation worsens insulin resistance. And this creates the question, what can you actually do about it without any crazy diets or expensive supplements? And step number one is to clean below the gum line without overdoing it. So most people think brushing harder equals cleaner teeth, but aggressive brushing can damage your gums, it can create tiny tears, and can actually make inflammation worse. What you want is gentle, targeted cleaning, especially in between your teeth. This means using a floss daily, or even better, you can use something called an interdental brush. And it's not just about the food particles, it's about breaking the biofilm, that bacterial layer that sits undisturbed and that triggers your immune system daily. So if you do this once a day, gently, mindfully, you've already tackled the source of inflammation for most people. And step number two is to rinse the right way. No alcohol mouthwash. And this is a mistake I've seen a lot of people do. So I've seen some people use harsh alcohol-based mouthwash, hoping for a clean feeling. But what you end up doing is you can end up wiping the good bacteria along with the bad ones, and you also end up creating a dry mouth environment. Instead, what I suggest is you use a mild pH balancing rinse, or better yet, use something that contains xylitol, because xylitol doesn't just freshen your breath, it can actually starve the cavity-causing bacteria, and it can help support a healthy oral environment. And step number three is to clean the back of your tongue. And I know this might sound weird, but the back of your tongue is like a shag carpet for bacteria. And these bacteria aren't just causing bad breath, they can influence your entire mouth's immune profile. And what I suggest is using a simple tongue scraper or even the back of your toothbrush. Gently scrape a few times in the morning before you brush, and this alone can reduce those volatile sulfur compounds, lower these inflammation markers, and it can make your entire mouth just feel healthier and cleaner. And step number four is to keep your mouth moist and alkaline. So your saliva isn't just water, it's packed with enzymes, minerals, buffers that naturally fight bacteria and regulate the pH levels in your mouth. So if your mouth is dry from mouth breathing, certain medications, or dehydration, you're more likely to have an acidic environment where harmful bacteria thrive. So here's how I'd suggest you fix it. Stay hydrated, avoid constant snacking or sipping on acidic drinks, and I would try and use a xylitol gum because they can help boost saliva production and help balance the pH levels. And you don't need to obsess over every single detail here. And here's the big idea. Gum disease isn't just about your mouth. It's a low-grade chronic inflammation that can quietly interfere with your blood sugar, your energy levels, and even your long-term health goals. So the good news is you can start turning that around with a few consistent habits. And also let me know your thoughts in the comments down below. I usually read through all the comments and I'll try and answer when I can. And thank you for watching.